Greetings and welcome to week 5 of ME115. This week we're going to talk about HITECH Act and affordable care. And the Health Information Technology for Economic and Clinical Health, or HITECH Act, was enacted as part of the American Recovery and Reinvestment Act of 2009. It was signed into law on February 17, 2009 to promote the adoption and meaningful use of health information technology. Now, Subtitle D of the HITECH Act addresses the privacy and security concerns associated with the electronic transmission of health information, in part through several provisions that strengthen the civil and criminal enforcement of the HIPAA rules. Section 13410D of the HITECH Act became effective on February 18, 2009. It revised Section 1176A of the Social Security Act by establishing 4 categories of violations that reflect increasing levels of culpability, 4 corresponding tiers of penalty amounts that significantly increase the minimum penalty amount for each violation, and a maximum penalty amount of $1.5 million for all violations of an identical provision. It also amended Section 1176B of the Act. It did this by striking the previous bar on the imposition of penalties if the covered entity didn't know and with exercise of reasonable diligence wouldn't have known of the violation. So these violations are now punishable under the lowest tier of the penalties, and providing a prohibition on the imposition of penalties for any violation that is corrected within 30-day time periods, as long as the violation was not due to willful neglect. The interim final rule conforms HIPAA's enforcement regulations to those statutory revisions that are currently effective under Section 13410D of the HITECH Act. This interim rule doesn't make the amendments with respect to those enforcement provisions that were not yet effective under the applicable statutory provisions. It became effective November 30th, 2009. They kept open the comments until December 2009, December 29th, 2009, for any public comments. And it's finally closed. It closed and changed. We've talked about HITECH, so let's talk about healthcare regulations, HIPAA, HITECH, and Affordable Care Act. Regulation is a major concern for organizations that are operating in the healthcare industry. As a highly regulated industry, organizations need to ensure compliance within the industry regulations. Now, failure to do so could lead to substantial fines being levied, and negative publicity that could hurt the brand reputation and ultimately the bottom line of the business. And that's what healthcare is, guys. It's a business. Um, Therefore, organizations that are investing in real-time electronic communications to speed up the flow of information within and outside of the organization, uh, they've got to be aware of the implications of regulatory requirements on the use of those communications. Now, these new communications add infrastructure complexity, which might make it more difficult to comply with regulatory requirements. The main challenge facing these healthcare organizations is the ability to track, capture, and secure content from these new technologies for record retention and audition, excuse me, purposes. Um, and moreover, these communication technologies are prone to data leakage. With a single click, an ePHI could be inadvertently sent to the wrong person. Where the EPI is sent via any of these electronic channels, communication channels, the organization needs to ensure that it is sent securely, that it can be audited, and the records are made and retained according to the requirements set out by HIPAA. Now, here's a little overview of healthcare regulations that have an impact on the electronic communications. In the U.S., the Department of Health and Human Services, or what we call the HHS, oversees a number of um, regulatory bodies that protect the public from health risks, provides programs for public health and welfare. The Centers for Medicare and Medicaid, uh, which is CMS, oversee most of the regulations related directly to the healthcare system. Aside from running government subsidized medical coverage programs like Medicare, Medicaid, and the state children's health insurance program, CMS is also responsible for ensuring the industry complies with the Health Insurance Portability and Accountability Act. In 2009, the Health Information Technology for Economic and Clinical Health Act, or HITECH, was enacted to provide resources for the HHS to create a nationwide network of electronic health records, or what we call an EHR. Other than the federal laws that regulate the healthcare industry, organizations need to be aware that individual states may also have their local laws and need to be complied with. For instance, the length of time records should be kept. The government may require one time period, the state may require longer. So HIPAA, for instance, any organization that deals with the protected health information, or PHI, or electronic PHI, what we call ePHI, that is any health-related information that could identify the individual from names to test results and appointments, needs to comply with HIPAA. Other than healthcare providers, other organizations governed by HIPAA include health plans or insurers and healthcare clearinghouses. The HIPAA security rule sets national standards for the security of electronic protected health information for any entity that holds such information. HIPAA privacy rule protects the privacy of the individual identifiable health information. These specifically identify that person. The administrative simplification rules require a covered entity such as the physician billing, Medicare to retain required documentation for 6 years from the date of its creation or the date when it last was in effect, whichever is later. Um, HIPAA requires preempt state laws if they require shorter periods. Or excuse me, they preempt the state laws if the state laws are shorter periods. Um, so in other words, the state law is 5 years, they want you to keep this. HIPAA wants you to keep it, let's say, 7 years. You would have to keep it as long as HIPAA says you need to. The HIPAA privacy rule doesn't include medical retention requirements. State laws generally govern how long medical records are to be retained. I twisted those up just a moment ago, didn't I? What I meant to say is that the state laws will preempt, not the HIPAA law. So as I said, state laws generally govern how long medical records are to be retained. Highlights of some of the requirements for organizations concerned with HIPAA are like the following that I'm going to give you. Employee oversight. You've got to have procedures in place to properly authorize and supervise employees handling PHI and EPHI. Record retention. You need to retain the records in a large number of areas to demonstrate compliance and also respond to requests for instance from patients. So in effect, what we have in most places is we have a chart, we have an electronic chart, we have backups on computer drives. So we have those records in several places. Breach notification. If there's a breach of unsecured PHI or EPHI, the organization's obligated to provide notification of that breach to the affected individuals. The State Secretary of Health and Human Services, and in certain circumstances to the media. That notification has to occur within 60 days of the incident. HITECH requires that business associates of the organizations governed by HIPAA are compliant with the requirements of HIPAA. It has an impact on any organization providing a business or service to a HIPAA-regulated firm, and could include a law firm, billing company, even a copy shop. Copy, not coffee, copy shop. Another change brought about by the HITECH Act is, as we said, a change in the value of the penalties. Before the HITECH Act, organizations were fined between $100 to a maximum of $25,000 per incident per year. However, in 2014, the HHS imposed the largest monetary fine to date. That fine was $4.8 million on 2 organizations found to have breached patient privacy and security. That's a big chunk of money. What about the Affordable Care Act? Well, the Affordable Care Act requires all organizations to adopt more comprehensive record-keeping practices. Their new requirements include the plan must maintain records documenting the terms of the plan or health insurance coverage in connection with the coverage of in effect on March 23, 2010, and any other documents necessary to verify, explain, or clarify its status as a grandfathered health plan. Health insurance companies have to report on the medical loss ratio, or MLR, which is what percentage premium revenues were spent on clinical services and quality improvement. If the percentage doesn't meet at least 80 to 85%, then health insurers would have to offer a rebate to the enrollee. As part of this new incentive, health insurance insurers are required to retain documents and records of MLR for 10 years from the date that the calculations were reported to CMS. Organizations involved in Medicare Part D are also required to retain documentation for 10 years. Qualified health plans must maintain records of coverage, terminations in accordance with the requirements of the exchange. Health insurance issuers offering individual health insurance coverage, they're required to maintain for 6-year records of all claims and notices associated with internal claims and appeals process. And lastly, if a consumer completes a qualified health plan or QHP selection using an agent or a broker's internet website, the site's required to maintain related audit trails and records in an electronic format for a minimum of 10 years. So, there's a lot that goes on with these acts that are created and changes over time of fines and things like that. Having said all of that, it's very, very important that you have your medical records secure so that there's always going to be something happen somewhere along the way, but try to keep them as secure as possible and don't leave them laying out. I've been in offices where they just laid the file down on the counter. Anybody standing there could even just see. So don't, be very clear on what you need to do, how you need to do it. Thank you, and I look forward to your postings for this coming week, and happy studies. And if you have any problems, please contact me, and make sure to post on time. If you don't post on time, then it's part of my job to call you, to write you, to text you, and find out why you're not posting. If it's something that I can help you with, I'll help you with it. If I can't help you with it, I'll get someone who can. But don't just sort of slack off and not do your work. All work that has been behind is due the beginning of this week on a Monday. So after that, there is no makeup. I've given upwards to 4 weeks to make sure everybody caught up. So please be mindful of your work, and when you're in the workplace, be mindful of patient information. Have a great weekend, and I will talk to you later.